High blood pressure is often called a silent condition because many people never feel any symptoms at all. However, when blood pressure becomes very high, or when it has been uncontrolled for a long time, the body can begin showing certain warning signs. In today's video, we're covering 9 signs that may be associated with elevated or poorly controlled blood pressure, according to major health organizations. Keep in mind, these symptoms are not specific to hypertension and can have many other causes, but when they appear consistently, they should prompt you to monitor your blood pressure and speak with a healthcare provider. Let's begin. 1. Morning headaches. Headaches, especially in the morning, are sometimes seen in people with severely elevated blood pressure, often above 180/120ths of a millimeter of mercury. This is considered a hypertensive urgency or emergency when accompanied by other symptoms. Doctors believe this happens because very high pressure can increase intracranial tension and affect blood vessels in the brain. A mild headache alone does not diagnose hypertension, but recurrent morning headaches can be a sign your blood pressure needs to be checked. 2. Dizziness or lightheadedness. Dizziness is a non-specific symptom and can have many causes, but it is sometimes reported in individuals with blood pressure that is either very high or fluctuating. According to the AHA, dizziness is not a reliable indicator of hypertension, but when it appears together with other symptoms, it may signal unstable cardiovascular regulation. 3. Blurry vision or visual disturbances. The eyes contain tiny blood vessels that are sensitive to changes in pressure. Severely elevated or long-standing high blood pressure can lead to hypertensive retinopathy, which can cause blurry vision, seeing spots or floaters. Temporary vision changes. This typically occurs when blood pressure has been high for a long time or during a hypertensive crisis. 4. Chest pain or chest pressure. Chest pressure is a medical red flag and can indicate the heart is under strain. Hypertension increases the heart's workload and can contribute to conditions like angina, left ventricular hypertrophy, heart failure. Chest discomfort should never be ignored. Seek immediate medical attention if it is severe, sudden, or accompanied by shortness of breath, nausea, or sweating. 5. Irregular heartbeat or palpitations. Hypertension can contribute to structural changes in the heart over time, increasing the risk of arrhythmias, especially atrial fibrillation. Palpitations, feeling like your heart is racing, fluttering, or skipping beats, can have many causes, but uncontrolled high blood pressure is one possible contributing factor. Consistent palpitations warrant a professional evaluation. 6. Shortness of breath. Shortness of breath can occur when hypertension affects the heart's ability to pump efficiently. Long-standing high blood pressure is a major risk factor for heart failure, which can lead to breathlessness during activity or even at rest. If shortness of breath is sudden or severe, seek medical care immediately. 7. Persistent fatigue. Chronic fatigue is non-specific but can develop when elevated blood pressure puts strain on the cardiovascular system over time. This may reduce the efficiency of oxygen delivery to tissues and increase overall workload on the heart. Fatigue alone isn't diagnostic, but when combined with other signs, it's important to check your BP. 8. Facial flushing. Facial flushing is usually related to triggers like heat, emotional stress, spicy foods, or alcohol. While it can occur when blood pressure rises temporarily, the American Heart Association notes that flushing is not a reliable indicator of chronic hypertension. However, frequent unexplained flushing may warrant monitoring your blood pressure to rule out spikes. 9. Nosebleeds. Nosebleeds are typically caused by dry air, allergies, or nasal irritation, not high blood pressure. But in cases of severely elevated BP, especially during a hypertensive crisis, the delicate vessels in the nose may rupture more easily. Nosebleeds that are recurrent and unexplained should prompt a blood pressure check. Critical reminder: most people have no symptoms. Medical guidelines are clear. Most people with high blood pressure feel nothing at all. The only reliable way to detect hypertension is through regular blood pressure monitoring, either at home or at a clinic. Symptoms should never be the only measure you rely on. Recap: Here are the 9 signs that can be associated with severely elevated or poorly controlled blood pressure: morning headaches, dizziness, blurry vision, chest pressure, irregular heartbeat, shortness of breath, fatigue, facial flushing, nosebleeds. These symptoms do not diagnose hypertension on their own, but they are reasons to check your blood pressure and talk to a healthcare provider. High blood pressure becomes dangerous when it goes unnoticed. Recognizing these potential warning signs can help you seek treatment earlier and protect your long-term heart health. If you found this information helpful, subscribe to Hypertension Explained Simply for medically accurate, easy to understand videos about blood pressure and heart health. Take care, and I'll see you in the next video.